Nearly 2 weeks after an earthquake devastated parts of eastern Afghanistan, thousands of people are still without shelter and living in fear of landslides and aftershocks. At least 2,200 people were killed and nearly 7,000 homes destroyed. The World Health Organization has asked the Taliban to lift its restrictions on female aid workers so they can better help women who are struggling to access much-needed care.
This is one of dozens of communities still reeling from the earthquake in eastern Afghanistan. These children described what happened when the tremors shook their house and how they were dug out.
We were stuck in the room until our father came. He removed the stones that fell on us and took us out. Later, he also carried all our belongings out of the room.
Aid is starting to arrive, but many places are hard to reach and conditions are dire. Thousands are without drinking water and are being forced to sleep in tents or out in the open. For women, the lack of sanitation is especially bad.
There are no women's toilets or electricity. There's nothing I can do.
The UN and locals say, as with previous quakes, women and girls also bore the brunt in other ways.
Among those who tragically lost their lives in the earthquake, the majority were women and children. Many men were able to escape or move to safety, while women and children were often trapped and unable to flee in time.
The UN says the death toll among women and girls is often higher, as they're more likely to be confined to the home when disaster strikes because of the restrictions placed on their movements by the Taliban. They're also less likely to have the information they need to survive the aftermath because they no longer have access to education. The Taliban's exclusion of women from public life is putting them at risk, according to one activist who chose to remain anonymous because of fear of reprisals.
And also, this is terrible. Female survivors cannot access care properly because female doctors and nurses cannot go there and help all women. And the Taliban don't let us to go there and also help all women.
Some relief agencies say female aid workers are getting through to affected communities. But the World Health Organization says the paucity of women in such roles, especially doctors, is problematic and have urged the Taliban authorities to lift all restrictions on female health workers, especially the requirement that they can travel only with a male guardian. They say this is an emergency situation, needing all hands on deck to save lives and to ease the suffering of survivors.
Let's explore this with Kiana Alavi, who is the advocacy manager for the Norwegian Refugee Council in Afghanistan. She joins us from the capital, Kabul. Welcome to DW. Nearly 2 weeks on, what can you tell us about the situation for survivors of this quake and its aftershocks?
Well, the situation on the ground continues to be absolutely dire. As a result of the earthquake 2 weeks ago, many villages have been flattened. Over 80 villages have been impacted. And as you mentioned in your reporting, over 7,000 households have been impacted, and half of them are women. Half of those who have also been killed have also been women as well. The situation continues to be difficult as the aftershocks and landslides make the villages and areas affected be incredibly hard to reach. We've been on the ground as the Norwegian Refugee Council since day one. However, the amount that we are able to do for the affected population continues to also be limited, not just as a result of the access issues, but as a result of the capacity issues that organizations on the ground are facing as a result of funding cuts. As you mentioned in your reporting, we're still seeing that families are living in tents or living outdoors as a result of their homes being destroyed. Many of the homes in those villages were built from stone and mud, and as a result of the earthquake, they were destroyed almost immediately. And with winter around the corner, we're seeing a lot of risk to these families who have been affected. And without urgent and immediate humanitarian assistance, we're going to see the needs on the ground continue to grow.
Right, so physical access and financial limitations, are those the biggest things hampering your efforts?
Yes, they are. Thankfully, as I mentioned, our team was on the ground since day one. We've been doing assessments, joint assessments with other organizations. We've been delivering non-food items and winterization kits like tents and blankets. We've been delivering food and water. But when my colleagues were trying to reach the affected areas, they said that it took them hours as a result of the aftershocks and roads being blocked. We're seeing that authorities on the ground are trying to clear up the roads. However, these areas are still incredibly hard to reach. Assessments are still continuing because the needs continue to grow, and we're learning more and more day by day what the issues are on the ground.
The Taliban's restrictions on women have drawn international criticism. How are those rules shaping not just the immediate response, but also perhaps longer-term recovery for women and girls?
Well, as I mentioned, we've haven't faced any issues in the immediate term. We've seen authorities support humanitarian efforts because they know that the need is very dire. In the long term, it's difficult to say. As a humanitarian organization, we're very much focused on addressing the immediate needs of the population, and we're focused on supporting all displaced Afghans, including women and girls.
Has this disaster revealed any wider vulnerabilities about the way the country is being run under the Taliban?
I think a lot of the vulnerabilities have been there. Like I mentioned, the villages that have been affected and the communities affected, many of the houses were not built to withstand strong earthquakes like the one we saw. So it's not necessarily as a result of governance. Again, as humanitarian organizations, we focus on the needs of the people.
Thank you so much for talking us through that so clearly, Kiana. Kiana Alavi from the Norwegian Refugee Council.
Mia Park heads the International Organization for Migration in Afghanistan, working on the ground to deliver shelter, health, and aid services after the earthquakes. Mia, it's good to have you on the program. Let me just ask you, based on what you've seen on the ground experience, how are the strict restrictions that the Taliban have in place, particularly regarding women, how is that affecting the ability to help people in a disaster?
Disasters know gender. And this is something we've been really emphasizing with the communities and the de facto authority, because we really need to make sure that all genders, especially female, are well prepared to be able to cope. And during disasters, women and children are the most vulnerable. So it's very important that we provide specific targeted assistance for them. And of course, these restrictions are not helpful, and which is why we really try to advocate and make sure that we have female aid workers provide assistance to the earthquake, but for other disasters as well.
You know, we have had reports that female earthquake victims, that they have not received badly needed health care first, that they've had to wait, for example, for a female doctor or emergency response person to come onto the scene. Can you confirm that? Is that what has been happening?
I think initially, because it's mostly rescue operation, it was mostly male going to these sites. And also where the earthquake happened, it's very rough terrain, and then it's very difficult for anyone, especially aid workers, to access. We have data on the casualties, including deaths and injuries and others. If we look at the gender-sex divide, it's actually pretty 50-50. So it is not completely true that the aid workers, female aid workers, were not there. Just for example, for IOM, Initially, we had 40 people who are there to provide assistance, and 10 of them were our female staff.
Okay, I wanted to pick up on that. Would you say that there are enough female medical workers in Afghanistan right now?
I mean, of course, there is a general shortage of medical assistants, medical personnel, and especially female. But what's more worrying is rather the future, because girls cannot go to school, and including medical education.
That's right.
So in future, it will be a very tough situation where you won't have enough female health personnel to support the female in Afghanistan.
Yeah, that's a very grim picture, but it's something that we can see coming on the horizon. There are crises on top of other crises in Afghanistan right now. I don't have to tell you about that. Natural disasters, there's the forced return of hundreds of thousands of Afghans from Pakistan and Iran. We've been reporting on that. Long-standing poverty in Afghanistan. I mean, how do you handle so many urgent challenges at once?
You have summarized the situation very well. So we say, to start with, half of the population in Afghanistan depended on humanitarian assistance to survive, to start with. And then there are triple crises. One is the climate crisis. So you see years of droughts, frequent flooding, and then we also just now earthquake, right? The second is the huge return. So we're seeing millions, not hundreds of thousands, millions of returnees coming back from Iran and Pakistan, and they come back in quite dire situation. And this is additional 10% of new population added to already very insecure, fragile community in terms of economic opportunities. And then the third crisis that we have is the funding crisis. With all these disasters and the needs that are in the country, the ability for humanitarian assistance for an agency like IOM to provide assistance is quite stretched.
You're defining a perfect storm. Other people would say a perfect nightmare.
Yes, and you know, one of the departing ambassador was saying, Afghanistan there's a breaking point that's coming. We've been able to delay a bit, but the breaking point is coming. And unless international community step up and not forget Afghanistan and provide the needed assistance, it will be a very difficult time.
Okay. Mia Park, head of the International Organization for Migration in Afghanistan, we appreciate you coming into the studio to talk with us. Thank you.
Thank you.
Thank you.